So, welcome to the Safe Australia online meetup or something to that equivalent. Today, we are very, very excited to have our friend Rebecca Davis here to talk about safe in healthcare and generally safe beyond IT, which is topical for many folks. Some of your faces I actually recognize as thinking this will be very interesting for you. Rebecca is, well, I've known Rebecca since I think, we think, 20, April 2015, I think I met Rebecca in a beta, a test of the Safe RTE class in Boulder. She was very, very fun. She was kind of hard to miss. And we stayed in touch, and I still know her now. These days, she works for Scout Agile, which is very cool. So she's a Safe Fellow. She's a member of the framework team at Scout Agile. She's spent a lot of her career in healthcare, I believe. No doubt she will explain that. And I've heard her talk about her stories, and I love them, and I wanted to share them with you folks. So I'm going to hand over to Rebecca. She's going to kick off with some stories. She's always very, very happy to take questions. As always, you can put your questions in the chat, which I will validate is working properly in a moment. And we can read them in. You're also welcome to raise your hand and talk directly to Rebecca, with the caveat, if you talk to Rebecca, you will get recorded, which is okay. I think that's everything. If not, we'll make it up as we go. Morning, Rebecca, or afternoon, almost evening, Rebecca.
This is already like the funnest part of my day.
Really? But you,
Oh
you work
yeah.
on a framework team. That's not fun. Don't answer that. Don't answer that recording.
Fun, but a lot of them are at at Safe for Gov today. So I was particularly lonely today, and this is way more fun, especially because you are hilarious, per usual.
Thank you, I think.
So I'm going to do my best to share my screen really fast, but still be able to see you all, because it really does help if I can actually see your faces on stuff like this. So can y'all see a big screen? Sweet. Yeah, thanks for having me back to this meetup. The last time I was here, I think I talked about another particularly fun topic, Let's Get Lacy, which was just as fun of a title, and I had just as fun with. So you're gonna see in a few how I had fun with this title. But I'm excited because Em was mentioning it would just be cool to talk through some of the different healthcare experiences I had, and specifically the healthcare experiences I've had that were a little unusual, as far as working alongside doctors and physicians, having them actually embedded into my arts and embedded into my teams, rather than just like stakeholders or people that we talk to sometimes. So I'm going to give you guys a little bit of a tour of my career. And if there's an area that sounds particularly interesting, like go ahead and ask questions in chat, or just like unmute and say, can we dive deeper in a second? And I'll make sure to do that and leave room, because this is for you, not for me. For those of you who are on this call who have known me for a long time, I'm actually going to try to tell some stories today that you probably haven't heard. And particularly for Chad, for a minute, I thought you were actually in Australia because you have all those surfboards behind you. But Chad also, it's probably 6:10 p.m. for him right now. And he's just trying to like look Australian at the moment. Okay, now that I got picking on people out of the way. I am on the Safe framework team. It's really awesome, really fun. We get to think about a lot of stuff. And some of my experiences are ended up inside of the business and technology article, where we started to talk about business trains and things like this. And so you might see some shadowings of that as we talk along too. But for those of you who don't know me, I really love art. And so this title works well for me. not only because it's agile release trains, but I love art. So I'm really passionate in general about creating joy. I try to do that at work and make connected experience inside of work, and for the people I work with. But then I also, art is my hobby. You see it behind me, and when I do art shows, and I always really like the idea that I've created joy for somebody's house too, and that they took something I created and that makes them smile each day. So my first caveat or warning for this talk is you're about to see a lot of art, because as I was making this talk, I realized that I have done art with almost every art I've ever been a part of. So I decided that I would show you that art as I explain all the arts. And it might also be a fun drinking game early in the morning in Australia to just do a shot every time I say art. So that might also be dangerous. So I do have a little bit of an unusual agile journey. My first main career when I was in my 20s, I went ahead and just started a company rather than working for some other company. So I started a medical transcription and services company where basically I just went to various like small hospitals and larger doctors' offices in the South at the time, in the South of the US, so like Florida and Alabama and those fun states, and offered them digital transcription services. So when doctors take notes, they were at least the time taking notes into tape recorders, and then people inside of their office or services like mine would type up those notes and they'd get them back that next day, and that's your patient record. This was like right as things like Epic and other digital patient records were starting to come out. They weren't really out yet. So I also had a large group. By the time I sold my company, I had about 40, almost like most of them were retired women that worked around the US from their homes, typing out medical notes that had been sent in that I uploaded into this web service, and then they would type them and they'd go back into the doctor's offices. And I really learned in that time the value of just like thinking outside of the box, because I'm 20, I don't know what I'm doing, and I'm trying to like program all these computers that are sometimes like still green screen and like dot printers to do stuff that they were definitely not designed to do. And then just the joy of having a business where you get to employ all these different types of people that maybe otherwise have a harder time being employed. I also spent a lot of time physically with doctors of almost every single specialty. And through doing that, through spending time in radiology rooms with radiologists in like really dark rooms where literally one radiologist's like hand was like cramped and permanently in this position, and he had to have surgery because that's how you make your money, is just sitting there on a mouse and going through report after report after report in a dark room, to these surgeons or primary care doctors who really wanted to be able to spend more time with their patients and just weren't able to because the system isn't financially set up for them to do so. I just started thinking a lot about the healthcare system at large and the general unhappiness of physicians who had gone into school because they really wanted to make a difference and were starting to feel really hindered by technology and providing the care that they wanted to provide rather than enabled by it. At the same time, I was starting kind of a family journey where I was starting to figure out like different members of my family have just like really critical illnesses. So that was around the same time that I discovered my brother was dying of cancer care, or of cancer for one, and that just continued for pretty much the rest of my life until today. There's all these people in my family who are critically sick. So health and wellness has been a big part of me. So I ended up selling that company to a software company that wanted my business so that they could do business in the hospitals and doctors' offices that they want to do business in. And those hospitals and doctors said, we're not going to do business with you unless you can figure out how to do business with Rebecca, because we're integrated and embedded with what she does. Well, that company just kept building and building and building and never releasing anything. And they were just consuming all of the profit that my company had made to fund this like software that never got out the door. They were delivering tons of unkept promises to all these different physicians who were investing in them and just never actually delivering anything. And that really led me on the search for a better way. It's like there's got to be a way that you actually develop and deliver a product that isn't this, because this is nuts. So this image was my first Better Way experience. This is a paint night with a lot of the women from the first art I was ever on. So I went ahead and I got hired after researching like what's the better way. I researched about Agile and I decided I was going to apply to a Scrum Master job because that sounded really cool and a way for me to learn this new way. So I got hired at this company. I didn't honestly even realize that I was a Scrum Master inside of an art until much later. The C-level of this company at this time had read a lot of like Dean's books and the first version of the SAFe website. And they were like, yeah, this looks like it solves some problems for me. We'll just do this. And so it's not like we had like SAFe trainers or any classes or anything. We just had arts. And I just thought that's the way that medical devices work. Shockingly, apparently they don't really in usual places. But this particular company, I'm a Scrum Master, and I'm working inside of a team, and my team construct inside of this larger art is what is considered like too large of a team these days. But I loved it. It was great. I had 2 electrical engineers, I had a hardware engineer, I had 3 respiratory therapists, I had 2 software engineers, I had a content writer, and a nurse, and then a dev manager who also acted as the product manager. And we built the ability for you to be inside of an emergency room has a nurse and be able to actually see all the integrated data from all the emergency room machines in one place. And the way that we did that, and within a year, this company overtook the market in the US against like the biggest competitors, was actually having all of these different roles inside of Agile teams. And so we would actually like, we would borrow respiratory therapists and borrow nurses from local hospitals and do a rotation program every 6 months. So for 6 months, these nurses and doctors or respiratory therapists would be on Agile teams with us, and then they'd go back into practice. And we'd get another group of them, and then they go back into practice. And so they always knew the newest, what was happening in the ERs at the time and what they really needed, and they were able to test all the machines. So instead of like quality control testers that were software developers, we had nurses doing the quality control and respiratory therapists doing the quality control and building all of the risk documentation for the FDA. Instead of taking years, we would complete FDA cycles in 3 to 6 months, which is kind of nuts for medical devices, especially at the time. I didn't know that either. I just thought it was the way you did stuff. So that was just one team inside of this larger company. And all of the teams for these different products were blended teams like that. So I actually was looking, as I set up this talk for you guys, at like I had an old newsletter from that company. And one of them said, just so maybe you guys can get a feel, this was from the head of product, said, as we ramp up production with our existing vitals patches and bridges for hospital X, I'm not saying the names, we're also planning to replace the bridge with our new hardware that we've built inside the company in the first half of this next year. Our first units of hardware will be ready for testing in January, and with some creative software development, Vitals cutover can happen fast. Vitals is a great solution for emergency departments and for med-surg departments because it tracks patients' heart rates, respiratory rates, temperature, and uploads all of that data every 2 minutes instead of every 5 days like it's usually taking now. Hospitals are showing tremendous interest in the Vitals patches. Patients in early trials have stated that they feel much more secure in the emergency department, knowing that they are being monitored wirelessly. Patients said that the device is very comfortable and they don't even know it's there. So that's the kind of thing that we read in our newsletter every single week. And the reason we knew all this data is because we actually had nurses on our teams and what we called ambassadors, who were former nurses who would kind of live inside of all of our important hospitals. And they would be sending data back into the Agile teams almost every week for any of these hospitals that were testing new products for us so that we could pass FDA trials. So it was just continuously connected all the time. Everything was tight. You knew automatically all the time that what you were doing was valuable, and you never had any delay getting access to anything because you had all the people that you needed right there working iterations with you all the time. So that was my first ever like real job. And I moved from that role inside of that same company to later on being the risk manager for the entire organization. And risk management inside of medical devices is pretty serious. So even to this day, if a medical device that I signed off on gets used incorrectly or kills somebody, I can actually be brought up to Congress or put in jail because I did my job wrong if the company doesn't handle those device complaints properly. So it's a big deal to put your name on things. And I can say I wouldn't do that job in a company that didn't act the way that this one did. Because usually if you're a risk manager at other organizations I've seen, you're waiting to be given a set of requirements and tests that somebody built. And then you're sitting there with that like long list of requirements and you're documenting all the risks that you see inside the requirements. And then you send them like physically back to this other department and they read what you wrote and try to make new requirements. And then they send them back to you and you write all the risks and they send them back. And you're just like in this never ending cycle of documentation where you don't actually know if the risks are being addressed or not. You're just like hoping that they are and that these patients are safe. But what we did in this company is every Tuesday and Thursday of every week, I would meet with every single product development team, with all their engineers, with all their nurses, and we would go through their iteration plans for the upcoming iteration. And we'd go through every single user story that they had, and we'd have a risk conversation and say, like, what do you think this is mitigating? What is this helping? Whatever. And that made all of them like super engaged because they all part of the fun part of risk, if you do it actually with people, is you get to come up with like all the crazy ways something could go wrong. And engineers really like doing that. So they would come up with everything from like, okay, there's a Tesla machine and gets it rolled into the city and the entire city goes down in power. You're like, okay, but the probability of that, what's that? And so they would have all these really fun conversations, and then they'd end up building out new requirements for the next 2 weeks that would actually mitigate the most risky things or the most probable things. And I ended up with a risk product analyzing like document set that I just really believed in and felt confident in signing because I knew exactly what was happening and I went to demos and all that stuff. So this company is still very much in like my very top list of cool companies I've ever been a part of. Since then, I've gone to some other companies. So this one is one of those organizations that is a typical medical organization. It's very old, it's very big, and it's very slow. And they hired me to start to chip away at that. I knew they had a problem. And so they hired me into one of their major portfolios that had software and hardware devices. They'd heard about the products I'd worked at this other company, and they were kind of similar. So they wanted me to come here and help. And I feel like the first couple of days I walked into this company, it was so depressing because all the developers and all the engineers and all of the regulatory people are just walking around. They just look dead in their eyes. Like they just went to work. And it showed up in how they documented stuff and how interested they were in the products that they had to do. And so I kind of made it my mission not to actually change the world, because I knew that wasn't going to happen. The way that they had hired me in was saying like, this girl is going to change everything and none of you have the qualifications to do what she's going to do. And so I was immediately hated from anybody who was like in the project management world inside of that company, because they all got told they weren't qualified to do the thing that they had hired me to do. But what I could do is try to bring some like passion for the fact that you're making something in this industry that gets embedded in people's bodies and keeps them alive. And if you can like reconnect that in your brain, a lot of things just start to fall in place. So one of the things I did with this particular portfolio is to take all of the existing work policies, all the regulations, and we put them up on a wall. And this was a really big wall. It was more like a hallway. And so we just plastered all of the existing regulations, and I went through with all the engineers and the regulatory and the risk people and said, which one of these do we have to meet in the way that we've written them versus which ones have we written them and they're blocking us from actually accomplishing something great, and how, like, what's the way to rewrite them so that we can actually start to get work to flow through the system. While doing that, I tried to make sure that we had a hackathon about it too. So this is the Heroes and Villains hackathon. And this is a head hardware engineer and a head software engineer. And they're sitting and hanging out with each other. And while we're redoing all the different policies, I'm like, if you had to do like a full build on a medical device from like start to finish, I want you to try to do that in this hackathon and then kind of list out all the things that you did from a process point of view so that we can try to take this thing that takes us 3 to 4 years right now and break it down into something that's maybe not a day, but it's definitely not 3 to 4 years anymore. And I told them they could use any of the medical devices that this company had to build whatever they wanted. And so they did some really cool things. They took a respiratory device for a hospital and they made it Darth Vader themed. So when the alarms went off for the patients, it would actually like do Darth Vader's voice and it would breathe deeply. And then when it got back on track, Yoda would come on and like say some stuff and be like, yeah, you're good now. I think it was like, breathing you are, which is just awesome. So they had a lot of fun here and it just kind of re-energized them. And it had a really great like work impact of saying, okay, how did we actually do all this in a day when right now it's taking us literally like 3 years to get through the same thing you guys just did in a day. So that felt like a win. I think this is another way of like creating art at work, is just like finding all the different things that you have to paint with and then pulling them all together and making something cool. This was another art. So this is an art later on. So this particular one was an art that built a lot of different products. So this was a center of excellence art. So we tried to, the intention of this art was to break the mold on how the rest of the company built things and delivered things. So it's a really cool job to have. And we got to build a bunch of different products. But one of them that was particularly really enjoyable, and I think is meaningful for this particular talk, was application to make it again so that doctors could feel like they were doctors again. So primary care physicians could actually go and feel like they were actually in somebody's house providing care for people who actually can't leave their house. So especially if you have like chronic kidney disease or any of the really chronic critical illnesses, there are patients who, in order for them to get to the doctor's office, it's actually causing them harm by doing that, because the physical act of like moving to go do that is so painful and harmful for them. So we built an iPad application with this art that merged into a kidney machine and integrated with a home kidney device, which was new at the time, to really make it so that these physicians and these doctors could talk to these people every day. Because when you're on a kidney machine, a kidney dialysis machine, if you don't get the proper dialysis treatment, you're dead in under 24 hours, you're dead. And so this connected care was really, really critical. And through building this with the doctors and with the nurses, we learned all sorts of things. Like, you really need to be careful what you put on the iPads, how big it is, and what kind of screen you have on it. Because these environments with kidney disease are not pleasant. These people also tend to have bad vision problems and not be able to see very well. So you need to make it so that the font is a certain size so that it can be disinfected easily, because this is a pretty gross illness, and make it so that when they are getting treatment and care back from the doctors after, a doctor has a conversation with them, that they're getting clear notes on what to do next, and clear notes in such a way that it's easy to understand no matter how much pain you're in. And being able to work with the doctors instead of just like assuming that you knew what a good experience was like, was so meaningful for all of these developers, and for the patients and for the doctors who ended up, we got a note from one doctor who said, "It's been 25 years since I actually felt like a doctor again. Thank you so much." And those are the things that I think really, really matter when you start to bridge and build these connections. The one kind of thing I want to give you guys lots of room to ask me questions too is I do believe in creating beautiful arts. So this is an example that's actually in the Business and Technology article. This was a different art that we call inside of SAFE now a business train. So this was also home health. However, this was more of a national thing of being able to actually make agile teams out of a blend of software developers, regulatory specialists, hemodialysis technicians, tech writers, product owners, so that you could actually test and build new care plans for this like emerging market of having home care, have them learn from each other, and not only be able to give stronger care inside of this company, but actually create and test plans so fast with each other on a sprint basis in this mode to be able to actually sell those care plans to other medical companies because they're that much newer and more tested than the standard way of building care plans. So this was a really fun one to be on too. And this is one of the examples that's in that SAFE article now. I think a key is be curious. So if this is like a path you want to take where you just want to like work closer with other types of specialties than you are right now, or it's really hard to get information from either patients or doctors, or there's a lot of other specialties and types of work where you're starting to see more interaction, especially between hardware and software people. I think the key is to be curious and be Alice and remember that you can do 3 impossible things every single day. So why don't you just get started doing that? And while you're doing that, there's a lot of people in the world that can inspire you. So these are some amazing artists in other domains that I am just so in awe of every day. You got Robin Yemen, who's literally building gas stations in space and grocery stores in space. And as she's doing that, she's got dev teams of like space ability welders learning how to do software and software learning how to weld, so that they can see each other's points of view when they write stories and are working in iterations together, and start to build those like T-shaped skills that just cross all those boundaries. She also has this like robust history in like missile systems and is just one of the coolest people I've ever met. And her friend Suzette, she wrote fantastic book with that's doing really well about industrial DevOps. So how do you do that? How do you work across all these different systems to be able to do that well? I think they are both artists of their craft. And it's not medical care, but it's definitely like big things that really matter and just happen better if you have more types of people involved in the conversation. And then the fabulous Debbie Bray, who just pushes boundaries all the time and never looks at the framework as something that you can't play with. And I think helps other people figure out how to play with it too. I know she's helped me a lot. So I would find like those artists that you admire and try to spend some time with them or listen to them. I think thinking in a creative way and thinking about not only like art design, but organizational design is something that is so critical for any Agilist to really take a deep part in. I think the ability to help other people around you inside of your company understand that it's okay to be creative, and that it's okay to try new things, and it's okay to have fun at work in order to solve problems. Like this quote says here, it just opens up this huge range of possibility that you wouldn't have otherwise. So I just encourage you to go make art in your own company, because together we deliver care. So what do you want to talk about now?
That's such a fun story, Rebecca. Thank you so much for sharing. There's a question in the chat from Evan regarding the health train slide. Was there a method to the listing of the job roles? So home care nurse, support developer, home care nurse, support developer. Oh, it's a recurring theme there. So I guess could you
Yeah.
unpack the teams a little bit for us?
Yeah, of course. So everything that says Northwest, East, and South, those were regions of the United States. And so what would happen is we generally, if you're giving home care as a nurse, you have kind of this, you're assigned either a hospital or a set of patients, and you are assigned them as a solo nurse. And so you have this backlog of people, of human beings that you need to get through each day and make sure that they have conversations with you about whatever they need to. Usually if you're on home care, it's because you really will die without it. And so they're talking with them each day to make sure that they know enough to not die before the next day. And that can be an insanely stressful and lonely job for a single human being to have, because what if one patient just takes more time that day? You're not really set up in a system that's able to help you. They don't naturally work in a Kanban method to be able to share things with other nurses. It's just not how the systems are generally set up. So we decided to do something a little different here inside of this company, and alongside in partnership with these nurses, actually give them a Kanban system per region. And so a particular region would have a set of nurses that could work with any of the patients inside of that region, and they had enough notes from doing daily stand-ups with each other to understand the full patient set for that day and what really needed the full care. And then across regions, they would do retrospectives across the different regions to identify like what's working right now, what's not working. And while they're doing those retrospectives and those daily stand-ups, there were the devs and the support people are actually like, and the regional managers are taking notes of what's working and what's not working with all these patients across the different system, which ends up getting fed back into the home care core team with tech writers who are actually like listing out now proven care plans that other hospital groups or other nurses can now use to provide the best possible care. So it was like a connected working system. And what the support devs are doing in between is these aren't like your usual devs. For a lot of these home care situations, there's devices that are keeping these folks alive, whether or not it's a hemodialysis machine. And so they're actually able to like log into those devices remotely and fix something that's going wrong, or assign a new treatment plan or whatever.
Rebecca, if I can just ask some bit of insight here. I know that configuring Agile release trains is not an easy thing, and there's a lot of things to take into consideration, including sometimes you need to make some compromises. And I'm sure you're familiar with the concept of aligning a Agile release train to a value stream. This seems to be more aligned to some regional silos, and I'm just wondering how that might have presented some challenges. For example, I'm wondering how you would prioritize the program backlog.
Yeah, well, one thing, the whole thing is a train, and this one is actually optimized for care and learning. So I agree, when you're setting up arts, you're always like optimizing for something and sacrificing for the other. What we're optimizing for here is to have a set of patients that could get the best possible care in a particular region at any given time. So we weren't optimizing to make sure the technology was the best. We were optimizing to make sure a set of patients had the right people associated with them so that they could get the daily care they needed. And we were optimizing to make sure that across the different regions, the combined learning was coming back into the company so that we could use that learning to make other care systems that we had stronger. So it wasn't siloed by region as far as the siloing education. That's what the retrospectives and the feedback sessions were for every 2 iterations, and like the art demos was to make sure that we got the best learnings from across the system. But it was siloed intentionally because you can't you have to be able to, as a nurse in this situation, have a pretty darn deep understanding of a set of patients in order to give them care. And so if you don't dice those patients into like appropriate chunks, there's no ability for those nurses to do the deep level of care that they need to, or for the device folks to actually know enough about those patients' devices to be able to serve those accurately either. Does that make any sense?
Yeah. Okay, thanks.
For the backlog part, they built their backlog was somewhat, I would say, repetitive. The innovation was in how they use that repetitiveness to always create like the next best day for their patients. So it wasn't as much of like, let's do all this like new technology work. It was how do we get the most learning from what happened today in this new space? Because at the time, even having patients allowed to do this was still in a test trial in the US. Because it was considered, it is dangerous, honestly. If your patients aren't keeping up with it, it's dangerous. So it's still in a testing method, has a way of doing care to begin with. And so we're trying to learn our way into like the best possible way to make that happen. So that patients could actually do this and start to have a life again instead of living their entire life in a hospital seat hooked up to some machine.
Yep.
Yeah.
Rebecca, I'm staring at this slide while you're talking, and I see regional managers in agile teams. And I feel like at this point the world's just going to implode because there's a manager in an agile team. So I was curious if you could talk a bit about that.
Yeah, I mean, personally, and maybe this was from my very early experiences in that very first company, I've never been a fan of like the certain job titles can't be in a team or talk to whatever people. In this case, for care, regional managers are also have nursing degrees. They are nurses. What they're doing is making sure like that particular region is staying. I guess like the best term I can say is like healthy in the legal way that it needs to, so that everybody's getting the things they need at the time and space that they need it, that the patients are getting the care they need, and that we're following the laws that are at hand as we do so. So it's a pretty big connecting role. And that's also why it's very different from that kind of product owner role, because that regional manager is having really a full-time operational job inside of the organization, just keeping things running the way that they need to. But from the other side, I don't know, my first team ever that one I talked about that was so effective had titles all over the place inside of it, and people just worked together and got stuff done. So I've never really gotten that argument personally.
What other questions do folks have for Rebecca about healthcare arts or business arts or art?
Rebecca, have you ever had an experience with blending operational teams with, or maybe not blending operational teams, any operational teams with management structures, purely not feeding back into a development cycle, but just taking the operations side of the house and using some of these concepts to apply in that way?
Yeah, I mean, if I leave healthcare world for a second, yes. So I've also had quite a few experiences like in retail and sales. And so actually setting up arts or minimally agile teams has become increasingly popular, especially in call centers. So a lot of companies that have like big call center areas, whether I'm going to turn this off for a second, whether it's the type of company that is selling a lot of products, and so they're just getting a lot of calls, like service calls all the time. It's a kind of a similar thing to the nurse, except people aren't dying, they're just having trouble shopping, right? And those calls are insanely expensive for a particular company, because you're paying those like human wages for something that should have worked digitally inside of the system. So what some of the companies I've been a part of have started to do is to form those call centers into teams, and do very similar to what I was talking about with nurses, is have these like daily like support call stand-ups, figure out how they're going to manage the overall call volume, talk about things like, hey, next iteration is Valentine's Day. We're not only going to have like a lot of calls because we sell a lot of Valentine's products, but we're going to have a lot of pissed off calls because people don't want to make their, loved ones upset when they're trying to send them flowers on time. So figure like really just aligning on like, what's the thing that we're really going to focus on? How are we going to reduce call time while still like increase call satisfaction? How are we going to push people into the new digital product that answers these questions, most of these questions for automatically in AI? What feedback are we getting about things that needs to get back in the dev teams to do so? Like that's becoming more popular. Also, what's really been fun for me to watch, though I haven't been a part of it, is hotels are doing that a lot. So hotel staff is starting to actually like do daily stand-ups, has a full hotel, and then do retrospectives on a cadence to say like, hey, like how is this whole thing running and working together? And then one of the really fun ones I had was a set of retail store managers actually like watch me talk about something else. And so they were asking if I could help their retail stores inside of the particular stores that they had actually implement some agile practices to improve the store, which was really fun. And it ended up doing some cool things. Like there's no reason why these particular stores, like there's like a 30-year-old rule that everybody who worked there had to wear a certain type of shoes. And so through doing these like agile things, they were like, well, this is stupid. Why are we doing this? And so now everybody gets to wear the kind of shoes that they want to wear when they go to work, as long as they're closed toed and follow OSHA, which seems really simple, but that's like a huge retention thing for seasonal store employees.
Thanks. Yeah, I've also seen the hotels and retail industry doing similar things. It's a great example. I'm sorry, I forgot. I lost track of who asked that question.
Hi, my name's Melissa. I asked that question.
Hello.
I think I've met you before.
Yes.
Hi.
My focus was on not what was coming next, not who asked the question. There was a great question in here about your favorite art medium, just to segue into the art for a moment.
Acrylics, because they're very forgiving.
They're very forgiving.
Mm-hmm.
Another one here from Brett, who says he thinks his question was similar to Melissa's. That's going well. I can ask it anyway and see if we get a different answer. That could be fun. So Brett says, it was a great example and story. Have you ever had experience with creating, supporting arts, developing product solutions that require no developer tech roles, regulatory learning programs, solutions, or policy development?
Yeah, yes. And to give a couple more examples, there's a company that I was at that, again, I didn't talk about here because it wasn't related as much to healthcare. It was a healthcare company, but my job was to, what did they call it? I think they actually like ended up calling it the Scrum Master of Weird Things. So I ended up being like Scrum Master for legal and for regulatory and for the executive team and for like anybody who was not developers. And through doing that over, the first like 6 months, for, the first time for them and marketing, it just started to like come together that I was hearing very similar stories throughout all the different teams about what they were really needing and what they were really trying to get to and what was blocking them. And so we ended up very intentionally from all that feedback, building 2 different arts. One of them where some of the people were more embedded inside of the art, not inside of teams, to some of the existing developer teams. And then a whole kind of like operational art where that's where their dependencies were. So if you think about, especially like marketing, there's so much dependency on legal, and you should connect those things. Like, why wouldn't you connect those things once you figure that out?
Thank you. All right, folks. I have 10 more minutes of your time and Rebecca's time. Did anyone else have anything that they'd like to ask about?
Yeah, I've got one for Rebecca. Based on what I heard, you're dealing primarily with people that are sort of internal customers of the healthcare system. What about the patients that are external to the healthcare system, but they've got their customer journey right? And there's a high degree of variability between each patient. So the traditional lean approach might not work very well. You have to get into an approach that's more accustomed to variability and cues and things like that. Have you ever had any experience with that angle of the healthcare system?
I mean, yeah, a lot of these are those experiences because your patients actually, in most of these cases, you consider your patient part of the team. Like, that's kind of the way that you give the great care. They need to be heavily involved, especially if it's something critical. But you're reminding me, there was a point in time I was working with a couple of design executives, and they had done a really cool thing that they stopped paying attention to because I think they got other jobs or whatever. But it was called prescribed design. And they were actually working with patients across the US to have them design their own products while they're in the middle of like a particularly like intensive piece of care. And I like that so much that when we went to a different company, I actually just started asking the developers, like, do any of you have any critical illness experience? And we had like a product manager who had cancer and recovered from it. We had a team coach who husband had died when her daughter was very young, and she still had all the medical bills, where she had sat next to her dying husband trying to explain to her 3-year-old daughter that daddy is dying, while literally going through and marking 200 medical bills of redundant billings that they had messed up. But now that's your job. So every month we would actually like paper the walls with a different critical illness experience, and then try to solve making that experience better for the health, like the holistic kind of health experience. So yeah, I mean, I think the whole point of this to me is to spend an enormous amount of time with the people that you're affecting. And sometimes what you're affecting is the operational people in your company, like you're making their lives better. And sometimes while you're doing that, or instead of doing that, you're really focused on your patient. I mean, whoever your end person is the center of everything. And the more ways that you can make them the center, the better. I think the prescribed design site is like still up, even though you can tell they don't update it really much anymore. And it's really fascinating if you get time to go check it out, because it's got all of these kind of cool products that patients had just designed for themselves as they were going through something.
A lot of times the patients are paying directly for the products, right? It's the healthcare professionals, or it's the health establishment paying for the products. So we don't always take into account the actual patient.
Yeah, and I mean, that what you're just saying is what's driven almost my whole career until I started working at Safe and decided I'd like to help like more companies that can help people. But I think that there are healthcare companies who are definitely, the profit that they make is off people being sick. And there are healthcare companies where the profit they are make is off helping people become well. And what I've seen is when you get enough of a scaled company that actually has both sides, you start doing the right things for the right reason. They've got the money to do it, and they've got the incentive to do it. And then you really start leaning into your patients deeply, because all the financial reasons and the goodness reasons are what you need to be doing.
Okay, thanks.
Time for one more, I think. A question from Ramya. How did you go about restructuring that? Let me try again. How did you go about restructuring existing arts in healthcare? Are the arts aligned by products?
Yeah, I mean, Chad answered this a little bit from one of the companies that I've been at, but I'm a big proponent of at least looking at the way that you've organized your arts every single year in alignment with your upcoming strategy. So I would actually start in September at most companies I was at look at employee scores, customer scores, any of like the business measures that we're running, all the different dependency maps across the different arts, and what architecture we're trying to shoot for, and then work with the executive team to identify what's the strategy that we need to have for next year. Have we bought anything, whatever, and start to evaluate at first, like what's the highest level things that need to get changed, and then run a series of art definitions based off that initial conversation to identify what the art structure would be for the following year. So it wasn't that like everyone was aligned by products or everyone was aligned by X, Y, or Z at any given point. We were always doing like optimization for sacrifice exercises with the different layer of the right leader. So if I was looking at a solution train, I'm working with the VP level and the architects at that level, but pulling data out from the people of what's working, what's not working. If I'm working with arts, I'm going to work with the arts themselves. If I'm actually redefining the entire portfolio structure for the whole company, I'm going to work with the exec team. So working with the right level to define what's that next piece need to look like for the following year. And then working my way down the system to say this art needs to actually shift. Let's talk about how that shifts with those folks and how we get to that shift. So a series of value stream identification workshops.
Thank you
Thank
so
you,
much.
Rebecca. Yep.
This was it's always fun to talk to y'all. So thanks.
Thank you so much for coming along, Rebecca. And there's a bunch of thank yous in the chat as well. And so interesting to hear about some of your experiences. And you're getting rocket ships from Evan. That's very fun. Isn't the new Zoom update fun? Folks, so thank you for joining us again today. We will be back in approximately 2 weeks. We will have Inbar Oren here while we're on our Let's Bring Safe Fellows to talk to people approach. Inbar's going to be doing an Ask Me Anything about the future of safe, and I'll get the meetup invite out to that probably later today when I have a moment. So thanks again for coming, folks. Thank you again, Rebecca. I'm sure we will have you back soon because you're so fun to it's so fun to listen to, and you know so much.
I mean, I'm no Inbar, but do my best.
Well, you're kind of even. I think he's done 2 and you've done 2, maybe. I don't know. Is it a race? Is it a competition?
It may now be. Thank you.
No. I'll let him know. You'll probably talk before I do. Thanks, everybody. Have a wonderful day, and we'll see you again soon.